Hello everyone, welcome to our channel, Group 29, and today we are talking about the study of the impact of different roles of the public on science communication based on the investigation of antimicrobial resistance, AMR. And in the following speech, I will expand from two parts, abstract and problem statement. First, let's start with the background. Antimicrobial resistance is a major threat to global health today. It refers to bacterial resistance to antibiotics, which not only makes common infections difficult to treat, but also leads to higher medical costs, longer hospital stays, and even higher mortality rates. According to the World Health Organization, without effective action, 10 million people could die each year from AMR by 2050. However, solving the AMR problem requires not only advances in scientific research, but also active public participation and action. Public engagement is an integral part of science communication, and the role of the public can be motivated from understanding correct antibiotic use to participating in policy formulation. But in current science communication, the public is often seen as passive recipients of information, ignoring other possible roles in the communication process. Second, our research goal is to analyze how the different roles of the public in science communication, such as informed citizens, advocates, or contributors to citizen science, affect the effectiveness of AMR science communication. And our research methodology is that the research adopts a mixed research method, including a combination of quantitative and qualitative methods, including questionnaires, focus group interviews, and media content analysis. Finally, the significance of the study. By studying the influence of the public role, we can develop more accurate communication strategies and improve the effects of public participation. Next, let's move on to the problem statement. AMR is a global problem, with more people dying each year from infections caused by drug-resistant pathogens. According to relevant data, the abuse of antibiotics is one of the important causes of AMR problems. In addition, there is a huge gap in public awareness of the problem of antibiotic use and resistance, further complicating the problem. Although science communication has made some progress in improving public awareness, the current communication is mostly confined to one-way information indoctrination, lacking the analysis of multi-role participation of the public. Second, the core issue is that there is currently very limited research on how the public can move from being information recipients to active participants, advocates, or contributors to citizen science. This makes it difficult for science communication strategies to accurately meet public needs and drive change in public action. If we can understand the specific role of different public actors in science communication, then we can develop more efficient communication strategies to make science communication more relevant to actual needs, but also more persuasive and influential. This is This will play an important role in tackling the problem of antimicrobial resistance. The core object of this study is to clarify how different roles of the public in science communication affect the effectiveness of AMR science communication. This goal has both theoretical value and practical application significance. Through research, we hope to drive innovation in science communication and get more people involved in the fight against AMR.
Okay, let's talk about the literature review. As we all know, we are living in a time when social media is everywhere. It has affected every part of our lives, and its impact on how we communicate, share information, and interact with the world around us is undeniable. In the field of science, social media play a more and more important role. Social media has been a powerful force in spreading scientific information readily and increasing public scientific awareness. Take AMR, for example, through social media accounts like Better Superbugs, relevant information has spread quickly. It has successfully created the attention of various groups, including health agencies, researchers, and the public. And this has greatly expanded our understanding of AMR issues, which its inconvenience and strong spreading ability, social media has broken the time and space limits that traditional communication channels have. Scientific knowledge can now reach more people and more effectively. Moreover, social media has created an active platform for the public to talk about science. In the AMR discussion, the public can freely express their opinions and share their experiences through blogs, online chats, and other ways. This has led to a rich and diverse discussion environment. Such participation not only makes the public think deeply about scientific issues, but also helps improve their scientific knowledge and critical thinking skills. The rise of social media has also caused big challenges in scientific communication strategies. When talking about AMR, communicators need to make full use of the unique features of social media. They should skillfully use communication methods like storytelling and carefully design communication contact based on the public cares about. This can greatly improve the communication effect. At the same time, communicators should actively interact with the public and quickly answer their questions and concerns. This can effectively increase the public's trust and acceptance of scientific information. However, social media also brings many challenges. One big problem is that it's hard to ensure the accuracy and reliability of information. The contact resources on social media are complex, and there's no strict screening mechanism. As a result, the public can easily be missed by one set or wrong information, which can affect their correct understanding of scientific issues. Okay, another issue is the serious problem of too much information. It's too much. It gets harder and harder for the public to pick out valuable content from a lot of information, which affects the quality and depth of scientific discussions. In addition, there are obvious imbalances and emotional biases in scientific discussion on social media. Some groups are more active in participating, while others are maybe left out. This makes scientific discussion less comprehensive and representative. Also, some members of the public are easily influenced by false information or emotional comments, which can cause unnecessary arguments and misunderstandings and mess up the rational discussion of scientific issues. In conclusion, social media has had a wide-ranging and far-reaching impact on public participation in scientific issues. It has created opportunities for scientific communication and public participation, but at the same time, it has brought challenges that we can ignore. In the future, we need to do in-depth research on how to make the most social media's advantages and effectively solve the existing problems. In this way, we can encourage the public participation more effectively in the discussion and solution of scientific issues and help spread scientific knowledge and improve scientific literacy. Okay, let's turn to the next part.
Good morning, everyone. Today I will be presenting on the study of the impact of different roles of the public on science communication, focusing on AMR. AMR is a critical issue in global health, and the science communication plays a pivotal role in combining this problem. Our research aims to explore how various public groups contribute to and shape AMR communication and to evaluate the effectiveness of those efforts. Our study begins with several key research questions. First, we want to understand the different roles the public plays in the communication of science. Specifically, how do different groups such as patients, healthcare professionals, policymakers, and general citizens contribute to or influence AMR communication? Understanding those roles is crucial for tailoring communication strategy to specific groups. The second question addresses the relationship between the public attitude and the science communication strategies. How do people's beliefs and perception about AMR affect how we communicate this issue to them? Are there ways to better align communication efforts with popular concerns to enhance engagement? Third, we ask what the barriers and facilities are in the public's understanding of AMR. What factors hinder or help the public in grasp the complex scientific concepts behind AMR, and how can those be addressed in communication? Our first question explores the effectiveness of current AMR science communication strategies. Are social media campaigns, community outreach, and other strategies truly effective in raising public awareness and influencing behavior? Lastly, we examine the role of the media in shaping the public's understanding of AMR. Given the significant influence of the media, both traditional and social, how do they impact the public perception and engagement with AMR? To answer those questions, we have identified several research objectives. First, we aim to identify and categorize the roles that the various public groups play in AMR science communication. This will help us understand how different audiences contribute to the discourse surrounding AMR. The second objective is to evaluate how public attitudes towards AMR influence the communication strategy employed. By understanding those attitudes, we can better tailor our message and outreach efforts to resonate with the public. Third, we seek to assess the barriers and facility in understanding AMR. This will help us identify challenges in simplify complex specific information and determine how to better engage the public in understanding the issue. The first objective is to evaluate the effectiveness of current AMR science communication efforts. This will involve assess whether existing strategies are successful engage the public and increasing awareness about AMR. Finally, we aim to investigate the role of media in shape public understanding of AMR. Understanding how media influence public perception will help refine communication strategies, particularly in using media platforms to spread awareness and encourage action against AMR. In conclusion, this study aims to contribute valuable insights into how the public engage with AMR science communication. By understanding the role of various public groups, the influence of attitudes, and the effectiveness of current strategies, we can better address AMR crisis. Thank you for your attention.
Hello everyone, today I'm excited to present the research methodology for our study, the impact of public roles on science communication, a study on antimicrobial resistance. This methodology outlines the comprehensive approach we will use to explore how different public roles influence the communication and understanding of AMR. To begin, we will choose a mixed methods approach that combines both quantitative and qualitative methods. This allows us to gather a wide range of data from statistical trends to in-depth insights, ensuring a holistic understanding of issue. The core aim is to identify patterns in how different public roles engage with and contribute to science communication on AMR. Now, let's divide how we are collecting our data. To gather data, we use four primary methods: survey, interviews, focus groups, and content analysis. First, survey. We will distribute survey to various groups, including healthcare professionals, educators, students, and the general public. This survey will focus on awareness, engagement level, and communication preference regarding AMR. Sampling will be done through stratified random sampling, ensuring representation across different demographics and roles. And then, interviews. In-depth, semi-structured interview will be conducted with key stakeholders such as policymakers, journalists, and scientific communicators. The goal is to understand their perspective on challenges and strategy in AMR communication. Third, focus group. We will organize role-specific focus groups, such as one for educators and another for healthcare workers. This discussion will explore group-specific challenges and collective insights on improving AMR communication. Finally, content analysis. We will analyze media articles, social media posts, and government publications. The aim is to uncover recurring themes, language use, and communication patterns around AMR in public discourse. By combining these four methods, we can collect rich, multi-dimensional data to answer our research question effectively. Now, let's discuss how we will analyze the data to explore how public roles impact science communication about AMR. Quantitative analysis using tools like SPSS or R will present descriptive statistics to summarize awareness and engagement level across groups like healthcare professionals, educators, and students. For example, how many people are familiar with AMR or how confident are they in discussing it? Through invariant analysis like ANOVA, or regressions, we will identify patterns such as whether profession or education level influence trust in AMR information or willingness to share it on social media. And then qualitative analysis. Interviews and focus group will uncover challenges like misinformation and public distrust, providing role-specific insight. For example, educators may struggle to explain AMR to students, while healthcare workers focus on relatable examples for patients. Content analysis will study media and government material to identify how AMR is framed for different audiences. Are terms clear? Does messaging vary by medium? And then integrate analyze. We will use triangulations to combine insight. For example, if surveys show healthcare professionals are most aware of AMR, but focus group reveal struggles in public communication, we can address this gap. Similarity, if government's messaging is too technical, public feedback will highlight the need for simplification. This configuration approach ensures we capture both chain and depersonalities to improve AMR communication effectively. To summarize, our methodology combines device data collection methods and rigorous analysis techniques to explore the role of the public in science communication about AMR. This study not only aimed to improve how we communicate complex scientific issues, but also strengthen public understanding and engagement of critical topics like AMR. That's all. Thank you.